Kingston Hospital is a medium-sized district general hospital in southwest London. It's a trust with over 3,000 staff, with around 520 beds, and we admit around 66 to 70,000 patients per annum. The trust was fortunate enough to win a grant through the NHS Improvement, now NHS Digital, called the Nurse Tech Fund. It meant that we could bring to reality some of the incredible innovations that we wanted to see to make a difference.
When we deployed VitalsLink, it helped us reduce the amount of time it took for a nurse to complete a set of obs.
We saved a lot of time for the nurses at the bedside, taking observations, not just to document, but to then tell somebody about those observations and the patient's condition.
I can't imagine going back to paper. I mean, the hours spent looking for notes and looking for CAS cards was actually ridiculous. I reckon I spent a good hour a shift looking for notes. That's all gone. Those hours have put us at the bedside. They've given the nurses more time to spend with the patients.
That information is integrated directly into the clinical record system. But further than that, we are able to transcribe that information through an algorithm, which then alerts our rapid response team through a dashboard.
We've gone from relying on a system where people are bleeping us and telling us about these patients to being able to see them and visualise them and look at them remotely and decide and assess whether or not we actually need to go and see those patients.
A patient in a bed might be able to say, I'm feeling really hot, I can feel my heart racing, but for some people, they're not able to do that. So these observations are absolutely critical to be able to understand who's getting the poorliest the quickest.
As we all know, sepsis is a big killer, and if you don't catch it quite quickly, it has bad outcomes for patients. The sepsis algorithm monitors loads of parameters that we're entering into the system electronically, and if you get more than 3 out-of-range parameters, the system will flag a message for the clinician saying this patient is showing signs of sepsis, please do a sepsis screen.
It helps us do a job because in the past, unless we were contacted by a bleep system, we wouldn't have known about these patients. So I think from a cost perspective, you can't put a cost on life, really, can you?
Having the input of Surrey and helping us to shape our roadmap, to do the things that are right for us at the right time and move us towards being paperless and having electronic records has been really important.
Kingston Hospital has long had a strategic aim to improve safety and improve quality and improve the patient experience, and that's what we've managed to achieve with this project.